Talk Radio. In the meantime, let's move on and get into some other bits and bobs floated about this week with our Friday panel. Ellie Mae O'Hagan is a Guardian columnist and director of the Class think tank. Ellie, hi, good evening.
Good evening.
Bill Bowkett is a political commentator and a reporter with Reaction. Bill, hi.
Very good evening, Darryl.
Thank you both for being with us. Really, really appreciate it. Listen, we have to start with domestically one of the biggest stories of the week, and that is the astonishing / not really astonishing, given the way that we've talked about workers' rights in the last decade or so, scenes out of P&O Ferries. Let me bring you what happened on Thursday when the CEO of P&O Ferries announced this to their staff.
The company has made the decision that its vessels, going forward, will be primarily crewed by a third-party crew provider. Therefore, I am sorry to inform you that this means your employment is terminated with immediate effect on the grounds of redundancy. Your final day of employment is today.
That was the CEO of P&O Ferries announcing that. Slightly tinny footage and a tinny recording because it was obviously being recorded as it happened. Just doesn't even bear thinking about having to hear that, does it, as a member of P&O Ferries staff. The government, Ellie, are looking at cutting ties with P&O, some criticising them for not acting on this soon enough or for even creating an environment in which this kind of thing can happen. Should we firstly be looking at cutting ties with P&O Ferries?
Absolutely. I think that the government too often allows companies to get away with things it really shouldn't, especially when the government has invested money in these companies. And I think that's the case with P&O. So P&O received £150 million during the pandemic. And really, we shouldn't be in the position where we're thinking about cutting ties with them, because we should have been attaching conditions to that money in the first place. And one of those conditions should have been that the workers would be looked after. And we are in this position because what P&O is doing is entirely legal. It's called fire and rehire. It's the process where companies fire workers and then they either re-employ those same workers on worse terms and conditions, or they decide that another group of workers is more easy to exploit, and then they replace the old workers with them, and that's what's happened in this case. We've seen Asda do it, we've seen British Gas do it, we've seen British Airways do it, and now P&O are doing it. And I think it really is time to create a new employment bill to outlaw this practice once and for all, and to strengthen the rights of people in this country when they're at work.
Bill, I hate to be a bit of a caricature of myself here and blame the government for everything all of the time. But I mean, Ellie's not wrong. This is a pretty stonewall example. I mean, there are some differences to what we've known fire and rehire to be, but effectively it is essentially fire and rehire. There was an opportunity, wasn't there, in Parliament for the government to outlaw this, or at least to begin the process of outlawing it and signal their support for that. They didn't. Are they culpable?
Yeah, I think that's definitely the case. I think for me on that question as to whether the government should sever ties with P&O Ferries, I would say no, but more for a technical reason, more to the sense that we're still uncovering some of the details around the contracts themselves and whether there was anything stated around layoffs or short-time workings. And also, there's still a lot of deliberation around the logistical issues that the 800 layoffs is going to have on ports of Calais, for instance, is going to cause disruptions because P&O has said that they will have to suspend operations to 10 days while they go through that transitionary period. But it does look, from the face of it, and judging by the reaction justified from these, hard-working, dedicated members of staff, that they've been absolutely conned here. And once the government have looked into the matter and seen if they've actually broken the law and unlawfully laid off all these members of staff en masse, then they have every justification, if they wanted to sever these contracts.
And I suppose on the wider point, Bill, that Ellie makes, we have to, I mean, I'm going to quote Keir Starmer. He said something earlier on in which he talked about the government having created an environment where a bad employer thinks they have a license to tear up staff contracts. We've talked a lot about workers' rights. It was big in the Brexit debate. Post-Brexit, Britain has to have a big conversation about what workers' rights mean and how we protect them and what we do with them going forward. I mean, this is a really big moment. Does this tell us that as it stands at the moment, we have done exactly that. We've created an environment in which an employer can do something as hideous as this.
Well, they've been able to do it, but I don't think they're going to get away with it. So I think, for instance, with this particular case, I take the words by Citizens Vice, for instance, because when you have to lay off more than 20 people, it's called the collective redundancy. And then that requires consultations not only with the employers themselves, who they feel they've been left in the dark, but it also means communicating with the unions as well. And that requires at least, a month to 45 days. So I think this is really being looked into, because in the government's word, in ministers' words, on both and on the opposition MPs' words, this is this has had cross-party support and quite cross-party condemnation.
Yeah,
but with the current laws in place, that they would think that P&O have indeed broken the law.
Okay, yeah, fair point. And actually, I think I wonder, Bill, just really, really briefly, on the point that Ellie makes, though, about this being, and actually, I suppose Keir Starmer kind of makes the same point, about this being a climate that's been created. We've created a climate in which, whether it's lawful or legal or not, or whether it turns out to be something that they get pulled up for or not, they felt like they could get away with it. How have we created a climate in which they felt like they could get away with it?
I think it's because, in the last 40 years, especially the development within capitalism in neoliberal Britain, that companies, especially ones that have such a hegemony on the market, especially P&O Ferries, especially in ports and seafarers and business as well, that they can do actions like these. But I think you've hit the nail on the coffin there, that now in post-Brexit Britain, especially when it came to European settlements and their rights when it came to employment, now the focus needs to go onto workers living in Britain.
Okay, let's move on, and we'll talk about something else, because we're a bit tight on time. But I really want to get to another story that I suppose we're going to have a conversation about in the next couple of days and weeks, and that is the numbers of COVID cases. They're rising sharply. A new variant, the BA.2, believed to have been contributing to about 1 in 21 people in the United Kingdom testing positive. Ellie, is this a bad time to scrap free tests?
I mean, I think that any time is a bad time to scrap free tests, because we live in a country that has universal free healthcare. And if I'm worried that I have cancer, I can go to the doctor and get a test for that. Any disease where you can get a test to see if you have it on the NHS, it's free. And I think COVID should be no exception to that. And let's remember as well that what we want is for people to catch COVID early. I don't know about you, but for me, when I got COVID, I thought, okay, well, I better rest now. And I might not have if it was a cold that had felt that bad. And I think that helped me recover quicker. So we want people to rest, but we also want them to be a little bit more careful when they have COVID, to stay at home if they can, and to not pass it on. And tests help all of those things. They help us manage our own behavior so that we get better quicker, and so that we don't pass the virus on to other people. And that's why they're a really good investment, because they actually look after people in the long term. So I think we shouldn't be talking about getting rid of them for free at all.
Well, that's a really good point, Bill, isn't it, that Ellie makes there? Because the conversation around free tests tends to sort of revolve around taking people out of society. I think people see it as being an affront on their liberties, right? That you have this test, and if you've got the virus, and you've got to stay at home, and it sort of plays into that big kind of really unhelpful conversations we've been having around lockdown. Whereas actually, I suppose the best argument for retaining free tests is that if you are somebody who would need to have an intervention, like there's going to be, there will be an increasing number of early intervention medications or medications that you can take in the first couple of days of being diagnosed with COVID, which will reduce your risk of needing healthcare. You need to know you've got the virus, don't you?
I think, but the thing we need to have also perspective when it comes to scrapping free tests, and I think Ellie does make a good point when it, being free at the point of need, especially, in tracking COVID at the early stages. And I think now a lot of the criticisms around scrapping free tests is that the symptoms you get from contracting coronavirus are conflated with illnesses like the common flu. But the thing is that when you look at the hospitalization numbers, you look at the level of deaths, and while cases are rising, as the ONS statistics show this week, COVID infection carries less mortality risk than flu in England. And we've come to a system now, I think, with the government of having to live with coronavirus, and the fact that free tests, while they have been magnificent, in tracking COVID, especially during the winter when there was the scare with the Omicron variant, the need for tests now have almost become irrelevant in many ways because of the high levels of antibodies, the risk that COVID brings nowadays, and also the unforgettable cost that tests bring to the economy. We're spending up to £9 billion every single year on COVID tests.
Ellie?
Well, I think that if there was a test available for flu that you could pick up at the pharmacy like you can with COVID tests or order online, I would like to have that as well, because, I have people that I love very dearly who have conditions that mean that if I was to get near them when I had COVID or flu, even if they were vaccinated, that would put them at great risk. So, I think that most of us who have people that we really love, who have these conditions through no fault of their own, that, mean that if they were to get COVID, and they would be very, very ill, I think none of us really want to imagine a bean counter standing in the background, working out how much that's going to cost, because actually you can't put a price on caring for the people that you love and keeping them safe by getting yourself tested and keeping away from them when you might cause them harm.
And also, the other point as well that I think we often forget is that there's a cost to people getting the virus, right? There's a cost to people being ill, and this is slightly anecdotal, and we'll get more evidence, I guess, in the next couple of weeks, but I'm seeing a lot of people getting a lot more sick. I'm not necessarily being hospitalised in the same kind of numbers, for sure, absolutely. I mean, let's not pretend that we were where we were in March 2020. We're clearly not. But there does seem to be an issue with waning immunity with some of the vaccines, which is inevitable. And I guess it doesn't remain the case, Bill, that not getting the virus is still the best option. And if I look at my week, right, so tomorrow night, I'm not on the show tomorrow night, by the way, somebody's covering the show tomorrow night, because I've got a 30th birthday to be at. On Tuesday, I need to travel to Belfast, unfortunately, for a funeral. So I really don't want to be carrying that virus from that party, into that party in the first place, and then to the funeral. Wouldn't it make sense, Bill, in a couple of seconds, for me to be able to have access to free tests, check my status, keep the people at that party safe, and keep my family safe at that funeral as well?
I think it's all about taking personal responsibility.
Which is fine if you can afford tests, but if you can't, then you're screwed, aren't you?
But here's the thing. I think when we look at tests, free testing, Britain's been very lucky in the sense that we have the privilege to have free tests. Whereas in countries like the United States,
but why would we throw that away?
Free tests for ages.
Why would we throw that away?
Yeah, but the testing in America, for instance, even for lateral flows, costs hundreds of pounds. Whereas Boots and Superdrug have said that their tests are going to cost, less than £2.
Guys, I'm out of time. So sorry, I'm really out of time. But nice to talk to you, Bill Bowkett. Thank you so much. And Ellie Mae O'Hagan.